Hi, this is Dr. Jason Dulac coming to you from my office, Dulac Dental, Springfield, Virginia. Today I wanted to talk about aftercare for immediate denture placement. So what is immediate denture? An immediate denture is when we take out your remaining teeth and put the denture in the same day. These aftercare instructions are for ones without implants or implants that aren't attached to the denture or buried under the denture. I have another video for aftercare instructions when we do an all-in-X therapy, which is where you attach the denture into the implants the same day of the surgery. So this is my aftercare instructions for delivering an immediate denture with all the teeth removed with or without implants underneath them. So if you have implants underneath them, you're going to see a stainless steel healing cap that's going to show through the gum. After the gum heals for a little bit, you do want to gently brush this. We give you some little brushes to brush that with. So that's the only really difference for when you have implants. Also, if you have an implant, the weakest time for the implant's about a month after surgery, 3 or 4 weeks after surgery. So if you're having a problem, especially if it's 3 or 4 weeks after surgery, any increased pain, bleeding, pus, swelling, anything like that, please call me. Those are the only two modifications for implants under a denture. If you don't have implants under your denture, we're going to deliver it the day of surgery, and then we're going to do a 24-hour check. Normally, I want you to take your denture out at night, clean your denture, gently stimulate the gum with like very soft brush, or some people like to use the edge of a washcloth or gauze or something like that. But you do want to stimulate that tissue so that you clean it. For the denture, the first 24 hours, I do not want you to take it out. So if you take the denture out in the first 24 hours, the tissue is going to swell and you probably won't be able to get the denture in for a couple days again. So the first day, just leave it in at night. We'll take it out the next day and we'll adjust all the sore spots. I usually tell people to expect 3 to 5 adjustments. Some people it's less, some people it's more. But 3 to 5 adjustments is average. So the day after surgery, we'll do a 24-hour check. We'll check your bite because you were numb the day before, and we'll check for sore spots. Anytime you get a new denture, there's going to be some sore spots. It's like getting a blister if you have a new shoe. So the denture's new, it might rub somewhere and need to be adjusted. That's why we do the 24-hour check. Past that, it's as needed. If you're feeling a sore spot, give us a call, we'll adjust it. It is easier for me to see how the denture is fitting and adjust it if you do wear it full time. Now, if it's sore and it's over the weekend or something and you need to take it out for comfort, go for it. But typically it's easier for me to see and adjust the denture if you wear it, you put it in the morning, wear it during the day, take it out at night and clean it, and go to bed without it on. Wearing it at night, some people do it for social reasons, but if you're gonna do that, you really need to stimulate and brush the gum. So I advise leaving it out at night. It's kind of like wearing shoes to bed, but if you're gonna wear the denture to bed, you really need to spend a good couple minutes kind of stimulating and brushing and massaging the gum. And rinse with rinse, clean the denture thoroughly, and then put the denture back in. But I recommend leaving it out at night. Should it be stored wet or dry? Different opinions and thoughts on this. If you store it dry, the bacteria are going to kind of die off. If you store it wet, it kind of keeps it in a similar environment throughout. The one thing I don't recommend is leaving it overnight in a mouth rinse that has dye in it. So over time, the blue or green in the rinse will pick up into the denture. So you can rinse it with mouth rinse, you can swish with mouth rinse, but I wouldn't soak it in mouth rinse for continuous periods. They do have denture cleaning tablets. If you're cleaning the denture every night with a denture cleaning brush or an old toothbrush, and I recommend just soap and water, liquid soap, baby soap, any type of unscented, dish soap, any type of unscented soap, just clean it with that, rinse it, and then store it dry or wet. They do make denture cleaning tablets, and since clear aligners are very popular now, they came out with something called cleaning crystals, which is basically a crushed up denture tablet. So whatever's cheaper, the cleaning crystals or the denture tablets, if you're cleaning them every day with soap and water, you're not probably going to need to do this. But if it gunks up, you can bring it into the office and we can clean it for you professionally. We don't charge for that. But if you want to do it at home, they make little ultrasonic cleaners on Amazon, or you can use denture tablets. But if you're cleaning it thoroughly every day with soap and water, you shouldn't need to do that. I do recommend soap and water over toothpaste. You can use toothpaste. The abrasive content in the toothpaste will slowly wear down the denture quicker. Also, if you're wearing the denture at night, especially if you're opposing natural teeth, it's going to wear down a lot quicker if you don't have a night guard. So anytime I do an all-on-X case or implant over dentures, I always do a night guard. If you're wearing your denture at night for social reasons, you may want to consider putting an extra layer of plastic, like an Invisalign retainer or something like that, over the denture so that you're not wearing your denture down as quickly, because Teeth on plastic, the plastic will wear quicker. Teeth on teeth is still gonna wear. Teeth on plastic, the plastic's gonna wear quicker. Teeth on teeth, your teeth are gonna wear. So everyone grinds their teeth at night a little bit. The people we say do it are the people we see the wear patterns on over time. And so if you have a denture, you invested a lot in that, especially if it's non-X, I always recommend a guard. If you're wearing your denture at night, we'd probably want to protect that with something, just so you wear down a cheaper plastic than resetting all your teeth in the denture and making you a new denture. So that covers cleaning, taking it out, aftercare. Immediately after surgery, your gums will puff a little bit, but then they're going to heal and shrink. And as they're healing and shrinking, which is going to take 3 to 6 months to fully heal in the bone, it's going to start to shrink. A denture fits like a suction cup. So as the tissue's pulling away from the denture, it's going to start to have voids in it. Adhesive is a great option for a while. At about the 3-month mark, if it's a little loose, we have a soft liner, or you can come back in, we can send it back up to the lab for a hard liner. So if we do an immediate denture, it's always going to need to be relined. I recommend a soft liner at about month 3 if you need it, and a hard liner at about month 6. It doesn't have to follow that pattern exactly, but that's kind of average. So if your denture is loose or you don't like adhesive, we can always line it with a hard or soft liner. And that's for a denture of any age. So if your denture is loose or ill-fitting and you'd like to get it lined, let us know. Adhesive. I do like adhesive, especially for immediates, just not in the area that the surgery was done for a couple weeks. So on the upper, usually there's no surgery in the roof of the mouth, so you can put a little dot on the upper. In the lower, if you've had areas that teeth have already been out, you can put a couple dots there. So a full set of adhesive would be, for the upper, would be kind of 3 pea-sized dots on the outside and maybe 1 on the roof. On the lower, again, 3 or 4 pea-sized dots going around. You just want to put the little pea-sized dots on. You want to dry the denture first, put the adhesive on, then soak it or run it under water so it's wet, and then seat it. And then the adhesive will kind of spread out, and it provides some extra cushion and retention to denture. We don't want this in the extraction sites right after surgery. So give it a couple weeks for the gums to heal up before you start using adhesive anywhere in the surgical site. It's not really going to get in there or really mess up the healing, but the adhesive is very sticky. It's very hard to remove. So if you're trying to remove it from the healing sites, it's going to start the bleeding again, which is basically going to start your healing at day 1. So it's going to delay the healing. You want to avoid that as much as possible in those areas. But if there's areas that have been healed for a bit, we can put a little denture adhesive down. The brand doesn't matter. There's lots of different brands. They're all good. We have some samples we give people the day of surgery. So we'll give you some as a sample. It's not that I recommend that brand. They all work. Just buy whatever you like the best, or whatever's on sale, or whatever's cheapest for you. If months after surgery you're having a little bone spur come out, give us a call. It's rare, but it happens. And if you have implants, it's going to be about 3 to 4 months before we can load those or put snaps on those into the denture. So we can put on a little snap, kind of like the snap on this jacket, into the denture at 3 or 4 months, and that really adds extra retention into the denture if you have implants. So at that point, we would add the little snaps in, and reline it as well. So that kind of gives you an idea of what to expect immediately after surgery as you heal for 3 to 6 months, and what we'll do. And then when you're in your final, that should be stable for a number of years. I've had cases done 5 or 6 years ago, haven't been adjusted or changed since. So we do recommend, if you're without teeth and no implants, once a year, come in for oral cancer screening and, just check the bone, check the denture, things like that. If you have implants, you can build tartar up around the implants. So you could need it cleaned every 6 months, or, some rarely every 3. Some people only need to come in every year. They're good at cleaning it. They don't build up tartar. So if you have implants, we'll let you know when you need to come in for the tartar around the implants. The immediate denture, if you don't like the teeth or setup, it can be switched out. So if you want to switch that out, just let us know. If you have any questions about aftercare instructions, just give us a call at the office, 703-451-4500. Thank you.